Ritika Singh. Her case will be a rare presentation of neurocysticercosis in young patient of Uttar Pradesh.
Good evening, respected seniors and my juniors. Thank you for this opportunity. Today I am going to present a rare case of neurocysticercosis in young female in Uttar Pradesh. So she is a 22 years female resident of Meerut with low socioeconomic status. She presented in mid-April 2024 with chief complaints of double vision when both eyes were open since 1 month, diffuse headache for 15 days and sudden onset of deviation of left eye inwards for 4 days. So as stated by her, she was apparently asymptomatic 1 month back when she noticed binocular diplopia, diffuse headache for 15 days, which was not associated with vomiting or nausea. There was sudden onset of deviation of left eye inwards for 4 days. So she also told us that there was history of miscarriage 1.5 months back. There was no history of trauma, fever, seizures or intraocular surgery. There was no history of similar illness in past. She's a non-vegetarian by diet. It was a non-consanguineous marriage. On general and systemic examination, she was an average build, well-nourished, conscious and well-oriented to time, place and person. Other systemic findings were within normal limits. There were no focal neural deficits. On ocular examination, position of head was straight while looking forward. Gaze was orthophoric. And on further examination, she had normal extraocular movements. Only I noticed there was mild hyperphoria in left eye. On a Snellen star, she was 6/6. With pinhole, she improved to 6/5 and near vision was N6. On Hirschberg test, she was orthophoric and anterior segment evaluation on slit lamp was within normal limits. Her intraocular pressure was also normal. On fundus evaluation, she had no abnormality. Optic disc was also normal. So what to do next? So we went further ahead with systemic investigation. She had normal CBC. Montu test was negative. We did torch examination. That was also negative. Chest X-ray, no significant finding. And we also did pure tone audiometry. It was also normal. So on further evaluation, on further investigation, we went ahead with contrast enhanced MRI brain with orbit. So you can see there were multiple lesions, hyper lesions with surrounding hazy margins in both the hemisphere, more in right, also in frontal lesion. And also in sagittal section, you can see they were also present in pons as well as cerebellum. And there was cystic lesion with eccentric hyperintense nodules suggestive of scolex. So the diagnosis is neurocysticercosis. So after neuroconsultation, we started her on oral prednisolone. Her weight was 65 kgs with antacid. And on day 3, we started her on oral albendazole 400 mg. So after 1 month, she improved drastically. So beautiful response after steroid. We can compare. Surrounding edema also reduced. Number of lesions has reduced. Both the axial scans, and also we can see in this coronal scan also number of lesions have reduced. So keepers are basically we have to be suspicious in postpartum diplopia and headache cases. We have to investigate thoroughly. We have to be vigilant. Early neuroimaging is very much appropriate in especially in non-vegetarian females, and there must be awareness among general practitioners as well as gynecologists that even in absence of seizures they must be thorough enough if she complains of either headache or diplopia or both. Thank you.
Thank you. You said patient came to you with inward deviation.
Yes, I noticed there was no actually there was no inward deviation. Only she complained.
It was her complaint.
Horizontal recti were normal.
And the movements were also, you said, normal.
Yes.